Good evening. My name is Dana Stewart, and I'm going to be talking about the existential theory. So, the overall view of this theory is how we define ourselves by our choices, how we have awareness and we have freedom, but it also comes with responsibilities. This theory talks about how people are constantly changing and growing, and it's all about experience. The fun thing that I do like about this theory is that there are no particular techniques to this theory. The counselor who uses this can basically use their own techniques to basically get to that goal with their client. This theory can also be considered as a way of thinking rather than a particular style of therapy. It's also known as psychotherapy, existential psychotherapy, helping clients to explore and understand their concerns and how these concerns affect their life. This process involves learning to face their problems, difficulties, crises, and disappointments that are part of living. These can also include dealing with death, anxiety, isolation, and so on. Um, some of the history behind this. Um, Soren Kierkegaard, I think I'm saying that right, a Danish philosopher, was considered the founder of this theory because he was skeptical abstract um, of abstract philosophical systems and thought philosophy should address everyday human concerns. Um, he also was not a psychologist. His work provided important insights into such problems as anxiety and depression. But there were also three other people that helped with this theory. That was Viktor Frankl, Irvin Yalom, and Rollo May. Um, some of the basic components of this theory is that the focus is on understanding the person's subjective view of the world. It does not focus on applying problem solving techniques, nor does it aim to cure people in the traditional sense. One of the aims of this theory is to help people face up to the difficulties of life with courage rather than avoiding their life struggles. Another aim is to challenge people to stop deceiving themselves regarding their lack of responsibility for what is happening to them and their excessive demands on life. Key concepts of this approach include self awareness, self determination and responsibility, existential anxiety, death and non being, the search for meaning, the search for authenticity. Authenticity, I can't even get it out, and aloneness. Um, so, differences in approach. Um, there were a lot of writers on this theory, but a lot of them did not address themselves. Um, they did not dress themselves therapeutically or did not address the overall meaning of this theory directly. One person, James Guggenzel, he was a key figure in the existential psychotherapy, and he wrote about life changing psychotherapy, which is an effort to help clients examine how they have answered life's existential questions and to invite themselves to revise their answers and to live more freely. So some limits on this approach was that many theorists' concepts are quite abstract and difficult to apply in this theory. Um, Let me see. Any counselor or any counselor or worker that is going to use this approach needs to have a great deal of maturity, enough life experience, and intensive supervision and training. I also feel like every theory should also have this as well when working with such clients. Um, the population that this would and would not work for, this approach um, is more towards people who feel alienated from the current expectations of society, or for those who are searching for meaning in their lives. It tends to work well with people who are experiencing transitions and who are at a crossroad and coping with the changes of personal circumstances such as bereavement or loss of employment. I just recently had to go through an experience with this at my internship where I work at a nonprofit women's pregnancy center, and I see a lot of my clients that come in and they we actually sit down with them first and we talk to them. We do an intake form and then we provide them with a lot of material resources. So the talking part of everything and the counseling part of it is they are always at these crossroads where they've just lost their job or they've lost their housing or they're going through like these big crises. Some of them come in just had death in their family, and I do feel like this approach and this theory would work well with these women. I've seen some of the counselors at my center use this approach before, and I will say that it definitely does work. Just to be able to see someone use the different techniques that they use to get these clients to this certain point. One of the strengths of this theory is It focuses on spirituality and meaning in life. And I can also go back to relate to my practicum site that I'm working at, because the center is a Christian base. So our clients don't have to be Christians at all to come. They don't have to be religious at all, but because it is Christian based, we do get a lot of Christians in there, and that spirituality kind of sometimes connects this theory with what we provide for these ladies. Um, some of the weakness for this theory is that those clients who want relief from specific symptoms or who are seeking problem solving methods will generally not find much value in this. Also, members that do not want to participate or maybe uninterested in the theory or the practice. So, multicultural implications. And some techniques that are associated with this approach is silence. Silence is one of the most significant interventions as a therapist can make. There needs to be a breathing space in between dialogue. Therapists have the task of listening with a receptive attitude so that the clients can move forward in a way of their choosing. I would say that I got to experience that with our summer class this summer. Silent did play a major part. Even being a client and having someone be the counselor and switch those roles. When you give that client the chance to think about what is going in and to soak in everything, it definitely builds a connection there for you as a counselor and for that client as well. Um, Another technique is questioning. Questions have a place in therapy, yet they need to be based on what clients are saying rather than probing for more information. It is best for therapists to ask open ended questions that are implied in the client's words and in the subtext of their messages. I also think that questions is a definitely great technique when using this theory and most other theories as well. When listening to what the client is saying, sometimes they might beat around what they really want to say, and by questioning them, by trying to ask them to define a word or define what this means, or asking them a open-ended question so they can get out and talk, you can kind of wiggle your way in and figure out what that client really means or what they're really thinking or how they're really feeling. Interpretations are used in existential therapy as a way to make sense of the client's overall story by connecting individual statements and experiences to enhance meaning. The puzzle to be completed is the client's, not our own. Existential group therapists may incorporate a variety of techniques from various therapeutic approaches. The leader sets the tone for the group not by introducing techniques and doing something, but rather by being and becoming somebody. So, with that being said, I think that when the counselor is in the room or the therapist is in the room, they have to be that leader. They kind of are facilitating everything and how everything moves. So again, I don't think that it takes a whole list of techniques, but if you know like your main techniques and where you're trying to go and where you're trying to lead with this client, they can definitely help. But not just one technique what will work with this theory at all. Different techniques will definitely work. Um, with that being said, that was all I had for existential theory, and that was from my fact sheet. Thank you.